before I begin, I would like to just kind of get a bit of a baseline of what people think this whole thing means. So just in the chat or somewhere, just whack down some ideas. Like, what exactly does it mean to think as if you want to do research or like a researcher? I just want to, let's just to start off with a bit of a baseline. Okay, to contribute to scientific literature. Yeah, that's a good one. I think it's always a good place to start. It's important to know what exactly you're going to achieve with that, but you want, I guess the literature is kind of your go-to. It's like the big ocean in which everything that you produce exists. It's a fair point to start. Gaps in science. We'll come back to that because it depends what you mean by science. Any other pressing ideas? Keep them coming if you want to, but yeah. So the way I like to think about research is, right. So for me, initially that kind of would be right. So the thing like a researcher is just, you think, you've got to be someone who is in the mindset of doing research. So that means you've got to think of someone who, you've got to think about how to do a study. What would it be like? What's the value of it? How are you going to achieve that? And to me, that's the kind of, it's a step going from someone who reads a study and can appraise it, can tell you what it means, useful, and then kind of moves on to, well, how can I do that myself? It's kind of going from initially reading and getting value from a study to trying to create that value yourself. And obviously to do that, you're going to be thinking about skills such as writing a paper or designing the methodology for it, learning statistics, things like that. It's more about at your fundamental base level, it will be about the steps needed to accomplish all of the work that is required for that research and how that will formulate the bulk of your project. And then that's kind of going from being a reader to an author. But there's another level to this, I think. And the next level that I want to really press on to is to think about moving from someone who tries to create research to creating a difference in research. You've got to think about the process of which research is done, the framework within which it exists, and the utility that people will get from that. So that is a kind of turning point where people can really start to make a difference and add value. And quite frankly, it will make people want to acknowledge what you're doing and to read and participate with the material you put out there. So I like to think about this from the frameworks of other industries and things like that, because I think there's a lot to be learned from doing various other aspects of medicine or wherever you are in your journey. So for me, the one that really helps is something like business. So for example, right, let's say you've never really done any business in your life. You're quite new to this. So how would you start to run a McDonald's? You start off by thinking, right, I've got to sell people Happy Meals, hamburgers, whatever. So you think about how much it costs to make them, how much it's going to cost to sell them, and you fit in everything else around your execution, your supplies. You make all that work around what your end goal is. And that's, again, you're thinking from someone who would be a customer, starting thinking to, right, like I've bought enough of these, how can I make them myself? But actually, that's only one level of the problem. Again, same as with research, there's another level to this which you can unlock. It's kind of like, you've got to think about, your marketing, your price point, who else is in the field. You've got to think about how you get to where you want to be, and a lot of other factors that go into it. And you've got to have that kind of attitude of figuring out those little niche gaps. Just like we do with research, it's all about the framework within which you exist and the process by which you get there. And that's how you can really make a difference. And if you want to go another level further, there's always this stuff to think about. Like there's, and this also exists within research. There's a lot of money to be for pharmaceutical companies and all this other stuff that goes on behind the scenes. There's a lot to be acknowledged that goes on. And this isn't really my intention to go into this ladder, but I think the more you know about the frameworks around who does research, why they do it, what value are they adding, what value are they getting from this, why would someone pay like $1 billion to make a drug, things like that, you really start to understand the different types of things you need to be good at research, but also where you can fit in yourself. And that's why I think it's really important to have lots of different skill sets. It's really important to be able to think on your feet. You've got to be able to understand like the different things that you'll need to get ahead and the different frameworks you're going to actually have to imbibe. So that might be being adaptable with different teams of people, different groups of projects that you want to do. Sometimes some work, it'll be, where you send it will be different. And sometimes you might even find that these things will evolve as you do a project. You'll realize that actually someone else has published a paper that's quite similar to yours. And in order to be sufficiently different, you've got to change your paper. Or maybe there's been a relevant change to the guidelines in the last year or so, and your work has to build on top of that, and it's got to adapt accordingly. Or in some cases, there might be other data that's been published that you can use yourself. Things like that will always be kind of ever changing. And it's really important to make sure that you understand what is going on around you, and that you're staying adaptable to that, but also thinking on your own feet, being laterally mobile in your thoughts, and just able to navigate the different contexts of what is going on, where you might be able to gain value, and so forth. So, all right. So normally when people go into the world of research, they'll see things such as these kind of models of how you can create a project, how you can really hone down onto what you want to do, how you get there, and how you can complete through your project and get it to some kind of publication or a paper or project or oral conference, whatever it may be. And they always follow this very linear structure. It's always kind of, you find out what you want to do, you collect your background information, you make sure that you understand the literature, you understand what's going on. And then from there, you can identify a gap within that, and you can develop your thesis, you can develop your hypothesis, you can test it. And then once you've kind of done your data analysis, once you've proven something, positive or negative result, you can then move forward and you can reference it, you can fit it in the framework of guidelines, you can write the paper, and you can submit that on to wherever it may be appropriate. This is pretty bog standard, and it always kind of starts with what your topic is. You always see this. This is your bog standard. Start with a question, you find out how to do it, you test your hypothesis. It's one of those classic things you might get asked in like an exam or something, like this, or not at this stage, but maybe back in the day in school. Or they always ask you about, the scientific method, because you can always test it. The science will always be as good as its last most rigorous test. And as long as you can continually build on that, and you can continually test and build on and refute work, you'll always get closer and closer to an objective truth. Kind of bog standard stuff. People always tell you that. It's nothing that I hope you haven't heard before. Then you might be asking, well, if you look at this, it always kind of starts with a question. So what kind of questions should we be asking? What's the point of all of this? And that's where you've got to be super, super careful, because at the end of the day, all of this work always comes back to question, some kind of observation, some kind of route that makes you think, right, why is this like this? Or how can I make a difference here? Or is there a better thing we could do in place of whatever the current method is? And it's this kind of base level of curiosity that you've got to have in just science as a whole. You've got to be asking people the right questions. You've got to be almost childlike at times, and just be wondering like, well, what exactly is the difference that I'll be looking to make here? But beyond that, it's not always so simple. It's the more questions you ask, the more you spend time around, other scientists or whatever, you kind of start to realize, well, which questions are actually worth pursuing? Like, how do these questions we ask actually lead to something more productive? How can they make a difference? So that's why people always talk about things like the SMART method. So, you've got to have goals that are, specific, measurable, achievable, all that. Like, it's just got to be used. It's got to be something that can be actually productive and not just out in the open as just a vague concept. And people always try to kind of drill this into you in the sense of you've got to be able to make your goals as focused as possible. And then that's why a lot of students always come up to me or whoever and they say, well, how do I find that in the first place? And it's kind of like why I said the chicken or the egg, because you just keep going around in circles where you need to be specific to start something, but then people don't actually know how to do that. And it's just one of those things where you have to have that level of curiosity and you've got to know what's worth pursuing. By some people say it's by getting things wrong, and then you learn from doing mistakes, you learn from reading what's already worked for other people. It's a host of multiple factors, to be honest. And from that, I think it's very important actually to start by learning from by learning from the things that other people did wrong, because it's great to learn from your own mistakes, but it's even more intelligent to learn from other people's mistakes, because then you realize that you don't even have to go there. You don't have to make that mistake yourself. You can just pick it up from someone else's shortcomings. And to start off with, like, the objectively one of the worst papers I could physically find and think of to do this project was this one. It should have a huge retracted sign on it, but I got the original because easier to read. So, quick exercise. Why was this such a bad paper? Ignoring some blatant findings, why was this such a terrible, terrible idea? Tough crowd, huh? All right. I'll just jump ahead to some of the stuff I had written down. But, oh God. So basically, before I go there, this paper was the famous paper written by Wakefield, and it's kind of this link between potentially having potentially linking autism to kind of inflammatory disorders in the intestine is the best way I can think about it. It's not really a study that was intended to prove anything. At the time, it was intended to be a case series with 12 children that had gone through, they were meant to be children that had previous diagnosis of autism, previous MMR vaccine, and an ongoing kind of colitis that was generally non-specific in everyone, but then they didn't really, I don't know, it's hard to explain because they didn't actually find that in most of the children afterwards. But initially the reporting was that the majority of the children had a non-specific colitis of some kind. Then from there, you've got these children, they took histories, they took inflammatory markers, they took a colonoscopy, and they recorded all the findings from temporally to link between the time at which they got the MMR vaccine and the time at which they were initially diagnosed of autism. And they did a bunch of other random tests, such as thyroid function, bloods, urinary dimethyl acid. There's a bunch of random tests that were kind of designed to identify whether there was any link between a potential infection and colitis leading to some kind of autism or pervasive developmental disorder, which this wasn't intended to prove anything. And it was kind of meant to be the initial report that was just put out just to see where they could end up with. And then from there, they were hoping that if they could find something worthwhile, you can build on that, you can do a bigger trial, maybe you can put something to the test. But context, I think you kind of realize that this wasn't really intended. This was very poorly conducted, and it's a very well-known example of research that didn't really achieve anything because it was so badly done. So these are some of the immediate things I thought were wrong with what they did. So this was a really big scandal in the sense that the results were made up, and some of the children didn't even exist. The symptoms they were listed didn't even exist. One child was literally flown in from America just so they could make up one of the 12. The conclusions that they listed weren't actually based off anything. They just vaguely claimed that they may have discovered a disease that links the two together, but you can't actually address that because you don't have any causative proof. Sample was not fit to justify the variants because there's only 12 of them, and they weren't selected in any specific manner that would allow you to make that inference, and the methods weren't appropriate because it's just a case report. Like, it's 12 people that you've just arbitrarily picked to do this. In hindsight, actually, it was quite interesting because they found that these guys had been selected from a support group of kind, and the support group was basically designed to act as a support group, but also like a political movement designed to upend the existing movement and to tell people that there was a link between the vaccine and autism, and that using that group in itself is very inappropriate because you have a hugely biased direct sample. And Maria, I heard one. Yeah, I don't actually know about that one. I've heard that as well. One of the kids was supposedly Wakefield's child, but I've never actually seen that confirmed. So one of those things we'll never quite know, I guess. But yeah, unnecessarily invasive pain. Yeah, also that too. Like, you don't want to give children a colonoscopy at all anyway, in very, like, you can avoid it. And I think there was a really big scandal around this at the time as well. When they had his GMC hearing, there was a big thing about how his consent forms were arbitrarily vague to the point where they didn't actually constitute informed consent for the patients, and that was unnecessary harm conducted in the guise of medical research. So all of this is obviously wrong, and it's clearly something that shouldn't have happened, but you can understand why, in hindsight, it's clear why he did it. We'll come back to this. Because Wakefield had received money for research, and also he himself was trying to make his own vaccine of kind and testing kits and things. So his framework to conduct this research was very much personal gain. And you can see that because you've got someone who's arbitrarily trying to shill, he's trying to arbitrarily do something is bad in order to justify something else that would be better. So it's almost as if the work shouldn't have existed because it only did that to justify his own ends. So actually, on that note, I want to kind of go through what might have been a better way to go about this. So say if you were genuinely concerned that there was a link between this vaccine and that disease, how would be a better way to design just think about something that might have been more appropriate. Say you're just having to think about this arbitrarily. You're an academic back in the late 90s. How might you want to do something a bit more ethical and a bit more useful to the community? So this was some of the ideas I had. And I think the whole point of all of these fundamentally is the framework within which these exist is that they're all designed to prove that there is a clear link between one causing the other. Obviously, your fundamental place to start would be a scientific trial. You might go into like lab work, you demonstrate the mechanism by which this is going on. Maybe it might take a mouse model or some kind of simulation or whatever it may be. But the starting point should be proving that there's actually something going on here. And then, retrospective analysis was a really good one as well. So look at who was vaccinated and what outcomes they got. If there's a link here, great. You're onto something. Then the other way I put it was a prospective follow-up of enrolled patients, but that could be problematic because in the meanwhile, whilst you're doing that, obviously you're still exposing people to something that could be hazardous. So same reason with a clinical trial, like you don't know if there is something wrong, or equally if there isn't something wrong, it's tough to not vaccinate children. Like that's one of the key rules with medicine is minimizing harm, making sure that we're always doing the right thing and we're making sure that there's actually something productive as an end goal. So what's kind of quite clear here is that the framework within which this exists is that it is asking the clinical question based off of a potential harm that is coming from something that is still objectively pretty useful. Like the vaccine itself overall is useful because it stops MMR, but it might have this possible downside to it. So now, to assess that possible downside, we've got to find a safe and effective way to causatively prove that and get an unbiased result of actually how good is this at what it's supposed to do and how good is it at what it's not supposed to do. So that's why it's really, really important to consider the kind of meaningful difference that you're always going to be trying to make. And it's like you said at the start, it's always important to assess how we can add to literature. Sometimes, that will often just be, it can just be keeping your eyes open in the field. Like you can learn a lot of things from what the consultants are doing. If there's a doctor that's doing something and he does it consistently, it's worth thinking about why they do that. Sometimes that will be from the guidelines. Sometimes that will be what they have from personal experience found to be most useful. Sometimes it's just that the alternatives make no difference. Like there are lots of things where you can do it 3 different ways, but it makes no difference how you do it. So like, for example, if you went in to a surgery and started asking someone like, why did you do this with your left hand? Or so it makes no difference, like you do it with either hand. Or, like how many knots should you tie? It could be 4, it could be 6. It doesn't objectively matter per se. Like there's not been enough evidence to tell you one is clearly better than the other. It is often just down to preference. And that's an acceptable reason to just leave things as they are. But sometimes, if there's something that's really inconsistent, it should ring alarm bells. And that's where the key thing that I want to impart in research is it's this combination of curiosity with a willingness to go and ask how things could be different, not asking why they are how they are now. And yeah, current practice, like there's a lot to be improved, there's a lot to be ongoing change. And sometimes you'll see that actually you're not the only one doing this. You'll realize that like lots of people have ideas that they want to work on, but it's not always possible on their own. So they'll reach out to you. They might find that there's something that they're already working on, you can get involved. Sometimes you might find that they will write a paper on something and they'll reference this and be like, actually, in the discussion, we believe that X, Y, and Z, which follows on from what we've done, requires further study. And those research targets will be something that you will pick up as you just acknowledge and understand more of the literature. And often major bodies that are involved in a certain field will also do the same thing, because they themselves have their own agendas and their own targets for what they want to be ticked off per se. So, for example, the NIHR, the National Institute of Health Research in the UK, these are their kind of top 7 pressing targets that they want to achieve post-pandemic. Obviously, a lot of these have been influenced by COVID itself, but some of these are kind of ongoing, and a lot of things like lives of people with long-term health conditions, that has been on their agenda since almost a decade now. It's kind of these big picture, large scale questions that, because they're so deliberately vague, they're also deliberately high yield, because multiple long-term conditions is such an distant goal. Like, you can never fully take that off because there are so many different types of long-term conditions, and there's no specific way to define how improvement may work. But the fact that it's being addressed as a National Institute of Health Research concern means that there will always be attention paid to this, and there will always be people that will use this. And that's actually quite helpful as well as a researcher, because you know that you have an audience for the stuff you do if you do it by these ways. So often people will cite these in their papers, like, oh, the WHO have put out a piece asking for work to be done on this, or it is one of their targets to achieve this by 2030, or, you know, in a recent study by this organization, it is found that their guidelines are weakest in this area. People will often tell you what they need fixed. And the truth is, the best researchers are the ones that pick that up as they go along and ask the right questions to fix that. But yeah, it's why I keep coming back to this. Like, you've got to be adaptable, because the world of research is always evolving, and there's no fixed way to get to where you want to be. Like, to make a difference, you've just got to be on your feet pretty much. And you can't do this on your own. You've got to have the right level of help, and you've got to have people around you who can ask those questions with you and can support the work that's being done. But yeah, I think that's me done. If you guys have any questions, feel free to throw them at me. Like,
Hiya, so thank you so much for that. I've definitely learned a lot. I hope everyone else has too. So there are a couple of questions. So I'll go from the beginning. So how did you build confidence to do your own projects without a supervisor?
I mean, you've got to start somewhere, right? Everyone starts off with your own kind of early stages of learning. You've just got to build up. And for me, I was quite fortunate. So one of my first big breaks, as you might call them, in research was with a doctor who was very encouraging of me to make my own mistakes and to build up from scratch. Very much like I want to do with this organization, to be honest. He set me off and he gave me the title for what he thought would be a good area to research. And after that, he showed me like how to create the models. He showed me how to do the statistical analysis. And like once he showed me the basics, like in his office, and he sat me down and did that. After that, he was very happy to just let me mess around with stuff. And improvise almost. So once I knew like what the variables were and how I had to find the causative models, I could then kind of go off and think about like, right, I've got this data and I've got to connect this with this. How can I best achieve that? So I'd kind of have a go at thinking about just messing around with different statistical models, messing around with um, different things that worked for me. And back then, I kind of knew that I could always trust that if I did something horribly wrong, he would tell me. And initially, that is kind of what you need. Like you've got to have that safety net of, if I get this horribly wrong, I can just revert and someone will tell me like, do this or try this or just put you back in the right direction. And then as I did more and more projects, I just became more independent because I realized that I had something that worked for me. Like I knew this, this statistical way is good for this kind of analysis. I knew that I had a style for how to write a paper. I had a style for how to think about like connecting up all the methods I wanted. I had a style for how to find the right people to work with because I got into that kind of networking. And honestly, I know this will sound cliched, but expect to fail for the first couple of times. I always tell people that like the first year of doing research is always your worst one. And it gets easier from there because you'll actually know what not to do.
Yeah, that makes total sense because I think the first time you get into research, nothing makes sense and you're just there. So it's kind of a similar question actually. So you've kind of almost answered it. How did you get into research as a student? I'm assuming this was your first project then.
Which one?
The one you just talked about.
Oh yeah, that one. Yeah, that was 2016, 17. Yeah.
Okay. So and then you've just kind of built from there and just worked your way up, right?
Pretty much, yeah. Just taking on more stuff. And then I think what's really important though is knowing when to ask other people to jump in and do stuff for you. Sometimes that might just be like if you know someone who's someone who's a student and wants an opportunity to do stuff, if you can teach them a couple of things and get them involved in doing something, that's always it's a leg up for them, but B, it's something that you can be quite proud of in the sense that like, right, I can teach this person how to do that. I don't have to do it, and they will never have to ask me how to do it again. So it's kind of this collaborative framework of giving people that opportunity. But also, I think I realized as I went on that I could just ask people for like specific things, and it's much more accessible if you have a really niche thing that you want help for, as opposed to just like an overall ask of, can I do a project with you? Because that is a lot more intimidating for someone who's going to have to devote a lot more attention to you. Whereas if I went to someone and said, listen, I've got this project, I've done this, and this, I need you to help me with this specific aspect of the analysis, which isn't working. They will do that because they know it'll take them a much more limited effort to do than to have to do everything else as well. So it's actually, you get way further and it's way more productive. Plus, that person will actually be more willing to work with you because they can see that you've gone above and beyond and done the majority of the work. You don't need supervision per se. You just need a little bit of structured guidance, which is much easier to provide for them and much more useful for you.
Yeah, kind of along that lines then, another question was, what are the limits then as to what difference we can make as a students and what we can contribute in research?
Oh God, I had a bit of an argument about this once. So I went to see a surgeon once, and I was telling him about NMRA, and he kind of told me like, that just sounds like a lot of babysitting, and I was like, maybe for you, not for me. And then we kind of had this conversation about the projects we can do and the work that he was offering me to get involved with and so forth. And how I kind of told them that like I try to be as independent as possible because I like to do stuff my own way. And I think that if I need help, I know it's available, but I don't want to always have to rely on it. And he was like, that's great, but at the end of the day, you're going to need a consultant to give you the questions to ask, because they're the ones that are going to utilize the stuff you produce. And he's not entirely wrong. Like, this did take a little bit of swallowing my pride to admit, but I kind of acknowledge why he said that. It's like, if he's the one who's going, if I publish something and I said, this is wrong, do this instead, he's the one who's going to have to change his practice to adapt to it. So it's like, in order for me to be able to do that and make that change, or at least suggest it, I think it is fair to say that I should go and ask someone who's going to use that, you know, who is an end user of whatever I'm recommending, and see if this is something that's actually practical. Because that's where a lot of research projects kind of fall apart. Like, it's easy to do the stats and be like, listen, this is 20% better than that. But then it's like, as a surgeon or as a doctor or whoever's using that knowledge, like, is it in line with what they would do? Is it in line with what's best for the patient? Those are very individual decisions. Sometimes guidelines will deliberately tell you to go with something that is worse because the better alternative isn't fully proven yet, or because it can have a nasty side effect, or whatever it may be. So I guess your limitation is, feel free to ask all the questions you want, but try your best to ascertain through literature, through people who will use your innovation, but feel free to ascertain if they're actually going to care about it.
Kind of following on from that, then, how do you keep the motivation going to continue with all these projects despite any outcomes?
I mean, you and I were talking about this before, but like, there's a pretty high failure rate within research. Like, structured research, you don't really see that, because if you're doing a PhD or an intercalation or whatever, you kind of don't have a choice. Like, you've got to publish something, otherwise you're not getting your degree, right? So it's more formalized. People will tell you things like, you know, you do this, and it's kind of laid out for you, but not entirely, so that you have no input in the control. It's more like they lay down the foundation for you, and then you can build on from that. Whereas with research outside of the formal part, there is no foundation. It could go horribly wrong. Some projects end up going absolutely nowhere because they're formulated in the wrong way, or someone else beats them to it, or whatever happens. Like, things can go very badly wrong in the world of research. And I guess it's one of those things where if you're not in the game, you know, that's the only way to guarantee you'll never fail. So in order to answer that question, I think it's just fair to, you've got to do a bit of soul searching, kind of think, well, what's the point of all this? Like, fine, like, maybe I did a paper and it didn't get published, but why did I write it in the first place? Like, did I write it so that I would, you know, like, if I was trying to make a difference with this paper, can I still make a difference by sending it to a conference, for example? Or maybe it's just a case of ignore publishing. What if I just go and speak to, like, the, you know, the management of my hospital? What if they might actually use this internally? You never know. Like, sometimes you've just got to be a bit creative, and sometimes you've got to accept that work doesn't always end up 100% going the way you planned.
Kind of following up that, just a question I had when you were answering that. When you approach doctors and hospitals, are they ever skeptical because you're a student, or are they kind of welcoming of your research?
I've had a fair few of both. Some people really like it. Some people like to test it first. So, like, I know someone who, he basically, before he'd actually speak to me about research, he was like, I want you to help my SHO fill out this audit form, like, so write up the abstract, like, submit all the paperwork for you to get the audit approved. And then once I'd done that, he was like, yeah, you know what you're doing. I didn't input a word into this. You know what you're doing. I'll talk to you now. Like, it's just one of the things where sometimes people ask you to prove yourself. Sometimes they'll give you a benefit of the doubt. Sometimes they'll just not talk to you at all. And that happens. But, you know, at the end of the day, if someone doesn't want to work with you, then that's on them. But sometimes people who give you a chance are the ones that want you to do well. So just take it.
And so I think you covered this in the talk, but I think just for clarification, how did you establish which hypotheses or ideas were worth pursuing?
That's it's kind of a multifaceted thing. So on the one hand, you've got like so in order to, you've kind of got, oh, where that slide go? Yeah. So this was, yeah, I mean, this is kind of useful for like, it's kind of a mixture of things. It's like, obviously it's useful to think about what's going on currently. It's important to think about how you're going to answer a question. So like, what is the structure of it? What is like, how are you going to answer your question? Where is it going to go in terms of who's going to read it? How are you going to get to that audience? Is it actually something that anyone cares about, in the sense of, has there been any previous reference in literature or guidelines or wherever where someone's like, this needs to be addressed? It's kind of a multitude of factors, and also it's kind of personal judgment. Like as you do more projects, you'll kind of realize like, a journal's not going to want this, so I need to kind of rephrase it or amend this or something, because not every paper immediately is the right structure. And it's like, there's like a common thing where like, very like, if you look at most journals, and maybe a small fraction of what they publish will be like a meta-analysis. So it's like, objectively, you're up against it, because they only take like 2 every issue anyway. So it's, there are like those kind of factors as well, but also it's about knowing, or who your audience is, how you're going to get to them. Fundamentally, it's like, who's going to care about what you do, and why would they benefit from you doing it? So answering the right question often just comes down to making sure that you've actually given them something useful to work with when they read your paper.
Just one final question I think there's here. What journals do you recommend reading?
There's no such, I honestly, I wouldn't say there's like a dedicated, like, one that I would be like, yeah, go read the Lancet. Like, that's not how it kind of works. I think if you like a particular field, obviously that's easy. Like, go and read the most prevalent journal in that field. But otherwise, the truth is, you've just got to keep your eyes open. Like, there's no point in being like, oh, I only read X, Y, and Z journal, or to be fussed about like what kind of impact factor they have. I mean, obviously, don't read something else like no impact factor, but like, relatively speaking, as long as the studies are well done, and you think that they're onto something, any paper is fair game. And if someone was to tell you like, read this journal, ask, like, think about why would they want you to read this journal? Because that in itself introduces an element of bias. Like, if you're only reading like a specific number of things, there's only so much you'll know about that topic, because every journal has their own biases, every journal has their own kind of area of focus. Every journal, you'll realize this as once you start like reading the journals themselves, you realize each journal focuses on specific things, and it can be quite kind of based on popularity or the interests of the editors, or sometimes even monetary gain. So, depending on what is the most prevalent therapy at the time, whatever. So it's important to kind of try and think about those biases that may exist within the framework. And that's why reading extensive, always go broad, then deep, is like the rule that I've been taught. And it's something I do stand by. Because if I was to tell you like, read one journal, you're missing out on like 100 others. So don't go that deep too early.
Kind of building on that, how do you choose, when you're writing your own pieces, which journals you're aiming for to publish?
Good question. So it kind of depends on, again, what field it is. For me, like, one kind of concern would be, is there like a relevant body that accredits this journal? So sometimes like a European society or some kind of organization will actually it'll be their journal, like that is the official journal, which can be useful because if they've got a hand in contributing towards research targets, or they're the people that publish guidelines, for example, they might be the immediate target, because then that's the best way to get your work noticed to those right people. And that can be very helpful. Sometimes it's about kind of the focus of the journal. So some journals will be really specific about what they like. So for example, there's a lot of cardiology journals lately that have been really getting quite into like TAVI kind of minimally invasive stuff, because that's really new and that's very cool. And a lot of funding is going into that. Or like a lot of journals have been really, really invested in COVID and literally taking no other submissions for a while now. So, you know, they have their own kind of internal targets, and you know that if you've got something on that already, they'd be a good fit for you because that's what the journal themselves want to promote. Otherwise, sometimes funding can be a concern. So if you're relying on like an organization to fund you, then they might say, like your things like universities or hospitals might have internal criteria for what journals they'll pay for, what they won't pay for. Sometimes if you've got sponsors or like other people backing it, they might have their own criteria, so where they want their work to end up. That's a bit rarer, but it can happen in some cases. But yeah, it's very flexible, and obviously it also depends. Like impact factor is also an important factor, and that's where you get quite caught up, because if you work with other people, they'll have their own opinions on this, and it's important to get to that like kind of the ideal team balance. Some people will get really caught up about it, some people don't care as much. Sometimes it can be a bit of a trade-off between going for a smaller journal that's more highly known for something specific, rather than a really big journal that's not really known for publishing in that area. So that can be hard to convince people to do, but important trade-off to make.
I think that's a really important point. It's actually something I struggle with a lot, trying to choose which journal. So that's all the questions that are on the slide. Any final questions, please feel free to put them in the chat, or even just turn your mic on. There's nothing else coming through yet. Yeah, so I think that's it for now. So thank you so much for all your questions, and for everyone for joining us today. Thank you so much, Niraj, for the talk. I've definitely learned a lot, because it's really hard sometimes to just think like a researcher as a student, because it's just something you're not taught about or even exposed to much. So we have a feedback form that we would really appreciate if you could fill out, as this is only our second event, and we want to make sure that you're enjoying the events and just finding them helpful, so that we can carry on building our society. So I'll put the link in the chat. If you could fill that out, we would be really grateful. So before we end, thank you again to everyone, and please make sure you keep your eyes peeled on our social media pages, so Instagram, Facebook, and also our YouTube channel, so NMRA on all three of those. And if you've missed our first event, then please feel free to watch the first event on our YouTube channel. So before we close, thank you again, everyone, for joining us, and enjoy the rest of your evening. And we'd really appreciate if you could fill out that feedback form for us.